Good morning and welcome to Seminole County's COVID update here in Seminole County's Emergency Operations Center. I'm Chairman Jay Zembower from the Seminole County Board of County Commissioners. On behalf of my fellow commissioners and all the mayors here in the Seminole County area, we're here to give you an update on many aspects of what's going on throughout the community. I want to thank the news media for being here, for helping us get the message out. I also want to thank all of our staff, our first responders, as well as our great community who continues to try to do their best to make sure that we try to contain the spread of the COVID, although we're going to hear from our health professionals and doctors today about some concerning issues that have cropped up on the COVID front. We also know that as businesses have started reopening, people are beginning to interact more than they have. We encourage people to, of course, do your social distancing, be smart, listen to the experts, which you're going to hear from here shortly, and following the CDC guidelines as well as those medical experts' recommendations. On the economic front, we learned yesterday from Governor DeSantis that Seminole County is going to get their portion of the CARES Act funding. You've heard us talk about here previously that Seminole County did not qualify initially for direct funding from the federal government because we fall below the 500,000 threshold for population. Other counties that had just a few numbers over 500,000 received $90 million plus. We don't know the amount we're going to receive, but we understand the governor's plan is to release that to us in quarterly releases. This will be required to be used for specific CARES Act funding under the federal guidelines. It will also require us to report, and there will be an auditing process with that. Any monies received by the county, not used for CARES Act or not expended for those expenditures, will be required to be returned back to the state of Florida. We are still waiting to see what those parameters are and how much that is, and we do not have that information yet. We hope to have that hopefully by the end of the day today or tomorrow, as we interact, with the governor's office and his indication of what they're going to do releasing there. I also want to take a moment and share with you about our small business grants that we've talked about, that we're funding people in small businesses up to $5,000 to be used for either mortgages, rents, PPE, can also be used for wages. That was kicked off over a week ago. We had about 1,217 businesses apply initially. Majority of those applied in the first 3 hours that we opened that. Of those, almost half were pre-qualified, and I want to remind those who have been re-notified on that pre-application, the full application is now due in June 19th. So make sure that if you received your indication that you qualified, that you get your application back by June 19th. There's only a certain amount of money there. Once that is exhausted, there is no more money in that program. Now, once the CARES Act money comes in, we'll be looking at that to determine if the guidelines coming both from the federal as well as the state government allow us to further fund small business economic help. It's my intent as the chairman of the county, if it is allowable, we will be looking and I will be pushing for additional help for the small business community. As we see the economy start to uptick, we see all the numbers and we see the stock market, but I'm telling you the small business community is still hurting, especially those with fewer than 25 employees and especially those that weren't able to open at all during the initial part of the shutdown, and then further those that could only operate at 25 and 50%. And keeping in mind, many of these businesses now have added expense because they now have to add additional PPE to their employees. They have to do additional cleaning in order to make sure that the public feels safe. And on that note, I would also say I urge all businesses, if you're going to be successful in this reopening phase, you must do what is right to make the public feel safe. I cannot tell you how many calls my office has fielded from people saying, I went to X restaurant or I went to this business, and oh my gosh, people were stacked on top of each other, they weren't wearing masks, et cetera, et cetera. business people, I'm a small businessman. I will tell you, you have to practice social distancing. You have to let people understand and feel they're safe, or they're simply just not going to come. I mean, we have the studies that show 50% or more are not comfortable going back out in public to restaurants and retail outlets. So, you need to wear your masks. Currently in Seminole County, we don't have an order that says you must wear a mask. We do recommend you follow the CDC guidelines. We also urge, if you've been diagnosed and tested positive for COVID, you do have to abide by the stay-home quarantine order. There's a $500 penalty for each occurrence under Florida statute, as well as our local ordinance and our emergency order. So I urge you to do what's right by yourself as well as your community, and stay home. I know a lot of young people think they're invincible. We were all young once. We all thought we were invincible. We all thought, hey, this is no big deal. But it may not be you, it's the people you're coming in contact with. It may be a 30 or 40-year-old that has an immune system problem. So be respectful of the rest of the community. I know it's been hard for people staying home. It's hard to be cooped up, but trust me, you're going to hear from our medical people. It's much harder to have the virus and give the virus to somebody that ultimately may be impactful considerably or lead to death. So they're going to talk about that in a few moments. Also, I want to urge people that do want to get outdoors. A social distancing element that you can do is the Central Florida Zoo. The Central Florida Zoo is suffering the same downturn that other individuals, businesses are. The problem at the Central Florida Zoo, we have a lot of animals to take care of over there. And of course, the cost of feeding and caring of those animals continue. So I would urge you to go to centralfloridazoo.org and buy your tickets. It's a great social distancing outdoor activity, and the zoo sincerely needs your help. So anything you can do to help the zoo, purchase a membership, get out, take the family, practice social distancing. It's an outdoor, theme park. So go out and enjoy that. With that said, I'm going to turn it over to Alan Harris, our medical director. Thank you, Alan.
Thank you, Chairman. Alan Harris, Emergency Manager here in Seminole County. The leadership team in Seminole County believes that we can reopen and have safe and healthy practices at the exact same time. It is not one or the other. Both can happen at the exact same time. If simple practices are followed, persons can remain healthy and the community can rebound. Today I'll give an update on the numbers. I will start with the good numbers, and then I'll enter into some numbers that have us has us a little bit concerned. The first is PPE. PPE is starting to come back. It's starting to become more readily available. While certain items like cleaning wipes, hand sanitizer, gowns, and N95 masks still remain in short order, other items like surgical masks, eye protection, and cleaners are becoming much more readily available. We are continuing to provide assisted living facilities, nursing homes, these commodities as they see it needs, and as they have problems finding vendors that will be able to supply them, we'll be able to provide them those types of materials. Another good thing that I can report is since our last press conference, so now about 2 weeks ago, we have had no additional fatalities here in Seminole County. So that is a good number that I can report to you today. Another good number that I can report to you is that while hospitalizations have gone up, and unfortunately we got another number today where the numbers continued to rise overnight at hospitalizations, they still are low enough to be managed easily by the three healthcare systems in the county. Of course, that was a major concern of ours at the onset of COVID-19. The numbers of hospitalizations continue to remain relatively low, even though they have gone up. They continue to remain relatively low and manageable by the three healthcare systems. So the numbers that are concerning to us, over the last 5 days, the number of positive cases that have come into Seminole County are now over 100. The highest increase in a 24-hour period actually took place just one day ago with over 30 cases occurring in that 24-hour period. Unfortunately, as we came in this morning, we found out an additional 26 cases came in overnight, so now 26 additional new positive cases are being entered into our system at this time. It is important to note that this is not due to increased testing. In fact, our daily test sites have actually decreased. This is just due to low demand. We are seeing that people are going back to work. So where we were having multiple drive-through sites on each and every day of the week, now we are doing approximately 1 to 2 all week long. So instead of testing thousands, we are testing around 400 to 500 in those testing sites, those drive-through testing sites per week. So we are testing less, actually, just simply because there isn't demand. We opened it up for well people to get tested. So if you feel great, you can go get a test. And people did that for a little while. We're finding that that is just not as big of a demand. Some of the test sites that we've opened up have very few people that have actually come through. So that's why we have decreased the amount of test sites. We're continuing to do about 1 to 2 drive-through sites per week for those that simply just want to go through a drive-through site and they don't want to go to an urgent care center. It's also important to note that these new cases are not reporting that they went to a drive-through site. These cases are individuals that have experienced symptoms and gone to a medical facility or a doctor's office. Frequent hand washing, facial coverings, and masks and social distancing is the key to staying healthy and safe. It is our hope that the information that we provide will help keep our community safe and healthy. It is not to scare, it is to educate, to inform what is going on in our community. We don't want anyone to get sick. We want people to stay healthy. We hope that the numbers will start to track down and that our community can go back to where it was. And where it was an average of about 2 to 4 new cases per day. Now the average is much, much higher each and every day. With that, I'd like to turn it over to Donna Walsh, Dr. Todd Husty, our medical director, for some information.
Thank you, Alan. Can you hear me okay? I'm going to keep my mask on. I'm 68 years old. It's important. It's very important. I kind of have to address what I'm concerned about in our community, which is how many times I've heard that this is not a big deal. This is a big deal, and it's getting worse. We were so close to zero. We were that close. And then we started opening up, which we should. Seminole County never really wanted to close down businesses. Maybe hair salons and stuff, which I think was probably, we realized, they can open back up again safely. I think businesses can be open safely. I think we can have a semi-normal life, but we can't ignore that this is a big deal. This virus, it doesn't know about rules. It knows about getting from one person to another. It knows about how to replicate itself. And it knows that it's going to take the opportunity whenever it gets a chance to go from one person to another. That's all. So the rules are all about virology. How does this thing spread? Respiratory droplets, a little bit on surfaces. It spreads because we let it, because we give it the opportunity. So how many of you have gotten that email from Nigeria? The one that says you're going to make millions of dollars if you work with this guy? Do you open it? Do you send it to your family? Do you send it to your friends? Do you send it to everybody that you can come across? No, because you're afraid that it's got a virus in it. You're afraid. Well, we should be a little afraid that me, could have a virus. You should be cautious. You should be respectful. I went out to breakfast last Monday morning with a bunch of EMS people. I'm sad to say that I was the only one with the mask on. I sat at the end of the table, away from everybody else, with my mask on, brought my coffee, never drank it, because how do you do that? Anyway, it doesn't work out very well. I took 2 N95 masks with me and gave them to the server that I knew was going to be waiting on us. She walked in a few minutes later without a mask on, and I confronted her. I said, "So you're not going to wear the mask?" She said, "It's optional." I said, "It's not for me. This is not optional for me." She goes, "Well, I didn't mean to be disrespectful." I said, "But you are disrespectful." And that's what this is about. Do we have respect for everybody else in the community or not? We should have respect for everybody else. That's what wearing facial covering is about. Inside is worse than outside. Or maybe I should say it the other way, positive. Outside is much better than inside. Get outside, do stuff. Ultraviolet light just zaps this thing. I mean, it's good. We are lucky to live in the Sunshine State, and that can help us. But when you're inside with other people, I look out right now to everybody that's here, we all have facial coverings, and we should. I mean, it's just the way it is. It is a big deal. This damn thing is opportunistic. If we give it the opportunity to spike, it will spike, and it will get worse. Remember, we now have over 100 cases in Seminole County. There was a time when New York City had less than 100 cases. And what happened? Tens of thousands. Tens of thousands. We could be like that if we don't really double back down again. Keep the businesses open. Go out and enjoy yourself. But do this. Wear facial covering, good hand washing, social distancing. We know what to do. We all did it, and it worked really well. So I encourage you to go back to that because it was wonderful. We were so close. With that, I think I'll turn it back over to Donna. Donna Walsh.
Thank you so much, Dr. Husty. And to assure you, we are keeping at least our 6-foot distancing here in the EOC in Public Safety Building. We appreciate your message. It's very much needed. My message to you all is, as Dr. Husty and Alan have mentioned, is we as a community have been doing very well. As we've started to congregate together and get around each other, we can't lose sight of those precautions that are so important. If you are going to be less than 6 feet from somebody or in a crowded area, please wear the protective covering because you're protecting others from what you could potentially be carrying. We still see evidence of people who are asymptomatic who can still spread the virus. I know that there's been some different guidance come out over the days, but at the end of the day, we do have evidence that asymptomatic folks can spread the virus. Certainly people who test positive, there's also evidence that they can be infectious a couple days before their symptoms even start. So again, the mask protects others around you, and as Dr. Husty mentioned, it's respectful of those in our community, one to another. I do want to recap some of the numbers as we have them reported from our Florida Department of Health dashboard. The statewide numbers as of early yesterday morning, because these numbers do come out around 11:30 every morning now, was over 67,000 cases statewide with 2,800 deaths. Here in Seminole County, and this was as of yesterday morning, again, 585 confirmed cases. That will definitely change this morning with the additional numbers of lab reports that came in overnight and early this morning. We have tested over just about 25,000 folks here in Seminole County, and we will continue to test as there's a need. Our outreach teams are going out into the disadvantaged communities, the communities where there may be underinsured and uninsured folks, and we've had 2 of those events this week where our outreach mobile unit has gone out into communities. As Alan mentioned, there's tends to be a little bit less folks showing up. We do average between 200 and 300 folks at the community-wide pop-up testing. We do have some scheduled for this week and next week through the month of June as well, and I'll go over those in a moment. But as you can see from the graph, and I know I often show this graph, but it definitely gives you a visual of what's occurring in our community, is we went from 8 cases reported one day to, like Alan said, 30 cases the next, and then we're almost at 30 again today. So those numbers from 0 to 5 average went up to close to 30 a day for the last couple days. I know I've mentioned these before. Again, I'm going to put the numbers into perspective for you. The week of April 19th, we had a total of 44 cases reported in Seminole. The week of April 26th, the following week, 40. We went down to 16 the first week of May, 16 again the second week of May. The third and fourth weeks of May, we had 27 cases each reported to us, 39 even the May 31st to June 6th. But just in the last 4 days, for this week, June 7th through the 10th, we've had 82 cases reported. So we're definitely seeing an increase in the number of people who are getting exposed. And a lot of these folks, looking at the age groups, a lot of these folks who are testing positive are in their 20s and 30s. The majority of them are in their 20s. So we have not seen any evidence thus far in our case investigations that there's a particular incident that occurred where a lot of people got exposed. These are just sporadic cases throughout our community. We're looking very closely to see if there's any sort of potential event that occurred where a lot of people got exposed, but it's just not evident at this moment. We're working continuously with our long-term care facilities because these are our most vulnerable. They are wonderful at complying with the precautions. They have received multiple visits from not only us locally here, the health department, our infectious disease epidemiologist, but also our state teams. We're very close to completing testing in every one of our facilities here in Seminole County, and I'm happy to report that the numbers are low on positive folks in our long-term care facilities. Those are the people who are going to suffer the complications from this virus. I'm glad that Dr. Husty is wearing a mask. He is in our at-risk group. He is one of the most vulnerable that could suffer complications. And so, we currently are monitoring 252 people. That includes our positive cases, about 120, those who are pending test results, who are symptomatic, as well as those who have been contacts to positive cases, which are over 122. Those people, as has been mentioned in previous press conferences, receive a call routinely from the folks here at the Emergency Operations Center to see if they have any needs, because we want them to stay home. They need to be isolated if they're cases. They need to be under quarantine for 14 days if they've been contacts to known cases. So even though we're opening back up, we still want you to take precautions, because we certainly don't want the numbers to go up and people to get sick. As far as the testing that's happening here in June, it's continuously with our community partners, the Florida Department of Health, the American Muslim Community Clinic, and Bueno Pharmacy, as well as True Health. At the health department every day, if you want information on how to get tested, you can visit us or call us. If we can't provide the testing that day, we will provide it through our partner True Health, who's co-located there at the health department. We started, effective today, drive-through testing at the health department, and that's from 9 a.m. to 1 p.m. every Thursday. We encourage you to call and make an appointment first at 407-665-3000. Select option number 1 to make that appointment, or you can call directly our appointment line, 407-665-3700. As I left this morning to come over for the press conference, there were a number of people in line. So, people are still interested in getting tested. We want to make sure for those who need tests that they have that resource, and, especially those who may not be insured. So please continue to reach out to us if you want information on how to get tested. We also are going to have a community testing Saturday, June 20th from 10 a.m. to 2 p.m. at Lake Mary Elementary School. The health department, in coordination with Bueno Pharmacy and American Muslim Community Clinic, will be hosting that. And then on Wednesday, June 24th at Spring Lake Elementary School, True Health will be hosting that event from 10 a.m. to 2 p.m. for those who need testing. So I'll just reinforce what others have said. Please continue to take the precautions that we, as well as CDC and our officials, have shared with you that the virus is still in our community. It still can be spread from person to person, and people who have underlying health conditions and who are elderly certainly can suffer complications and even die from this virus. The message has not changed. We just need to continue to take those precautions and protect each other. Thank you for all of your support.
Thank you, Donna. Thank you, Dr. Husty. Thank you, Alan. Thanks, everyone. And I think you've heard it. Because we're opening up does not mean this virus has gone away. It does not mean that you're not susceptible to the virus. It does not mean that we go back to normal. What it means is we must be smart. Business people must be smart, must be respectful. The community must be smart and must be respectful. We urge so we are able to continue to open up, and so that statewide the numbers flatten back out, that we can get back to some type of new normalcy. As Dr. Husty and Donna indicated, is we know what to do. We've done it before, and this was not necessarily not expected, knowing that people were going to get back out and begin moving around again. I think the more troubling part is understanding the age group that is now infected. And we again urge the young people, we understand you feel you're not, be able to be harmed, you're invincible. We were all there one day. But understand that doing this can and will infect others that it can be very detrimental to. Again, wash your hands, keep your hands away from your face, do all the things following the CDC guidelines, including keeping your 6-foot distance and wearing face coverings, when you're in close proximity and within 6 feet of people. So with that, we'll take any questions that the media may have.
I have one for Dr. Husty, if
Yes,
that's
sir.
okay.
Right.
I'm Nadine with News 6. Can you tell me at what point would you classify a spike? Would this be classified as a spike? And I don't know what the definition is. I'm asking many counties, so.
Well, a spike is a point on a graph, and so there are lots of ways of looking at this, and we've looked at it, how many tests come in positive. Since they're coming in a more rapid fashion than they used to, I think that daily spikes actually mean something. If you listen to, the other way to look at it is I look at 5-day moving averages. Take the last 5 days and what was the average 5 days before, and then yesterday and 5 days before that. And if you look at the moving averages, this is definitely a spike. It's changing. It's going from being very low to going up. That's really what the spike is. It's just a graph thing, but it's a graphic image of what's going on in the community. Is we have more cases. We have lots more cases, and it's escalating. It's not getting better. So when we first got into this, we talked about flattening the curve, Dr. Fauci and everybody flattening the curve. Well, that's what we're trying to flatten. We did it. If you look here, we took that thing and brought it down. We all did that. The public did that. So that's very disturbing. Very upsetting. I'm actually very sad.
When you talk about how people are getting this, the 20 age range, do we know if they're having parties? There was Memorial Day. There are protests going on. Do we know if any of that has contributed to these cases?
Yes. It's everything. We know that people are having parties and block parties, and they're getting lots of people together who are just not social distancing or wearing facial covering. I mean, I get it. Chairman Zembower said we were all invincible once. Obviously we were, because I survived. Because that stuff I did, I shouldn't have survived. But and so we were invincible. And it's hard, I'm sure it's hard for people to believe that they could be part of the problem when they're young. And they want to go out and have the good time that most of us had when we were younger. It's very difficult. I get it. On the other hand, this virus doesn't know boundaries. So it's going to go to anybody that it gets a chance to go to. So young people are going to get it, and they're going to be a source for everybody else to get it. And by the way, it's not just the old folks like me that die. There are younger people that die. I mean, not as many, not as high of a percent, but it's definitely there. This is a serious virus. I mean, it is not just your common cold. Who dies from the common cold? Nobody. This thing kills people.
Doc, talk a little bit if you could. So we have, by my math, we've had 117 new cases since last Friday in a county that was going 2-4, 2-4 for like 2 weeks. Through the epidemiology that you've done, talking to the people of these new cases, you know, with social gatherings, how worried are you that every one of these 117 may have also infected 2 or 3 others in that gathering, and we still don't know it?
We know that that's how this thing goes. That's why you see exponential. When they say exponential growth, it doesn't just double, it quadruples. And then that quadruples, and it keeps going up higher and higher, because every one person is going to come in contact with at least 2 other people close enough to spread the disease. So it goes from 1 to 2 to 4 to 8 to 16 to 32 to 64 to 128 to 256. That's exponential growth. I mean, it starts blooming.
So 117 can become 2,000 in a hurry.
In no time at all. At 117 could become 2,000 in no time at all. That's why I say, at one point, New York City only had 100 cases. A week later, they had 1,000, and a week after that, they had 10,000. I mean, just like that.
With this trend, are we looking at the possibility of closing down again if we got that amount of people being infected?
It is coming back, and it has absolutely the possibility of coming back with a vengeance. There's no 2 ways about that. I can't mince those words. We did a great job at flattening the curve, dropping the curve, making it almost zero. We were so hopeful. Alan and Donna and I would call each other every day, and we're going, this thing's going to go to zero. We were so excited. We're so far from that today. It's very disheartening, and it could go even much higher if we don't take some action. I don't think we should close businesses, my opinion. I don't think that we should be quite as strict, except for this, except for these, except for being farther apart from each other, 6 feet. Those things stop this darn disease. It's that simple. And they stop other viruses. It's not just this virus. We know how to handle it. We just have to get everybody to do it.
Should the mask be mandatory at some point?
Well, I think we all know, should the mask be mandatory is the question. I think we all know that there is enough people, a minority, but a very vocal minority, where they're not going to go for that. Should it? My opinion, Todd Husty's opinion, yeah. Yeah, I think it should be mandatory. I think it should be on airplanes. I think it should be in public places. We don't let people smoke in airplanes. We don't let people smoke in public places. Why? Because the smoking can harm other people. So why do we let people who may be carrying this disease harm other people? That's my own opinion. I think that there are a lot of people out there that feel like it's their right to not wear a mask. Well, I guess it's their right to infect other people. I don't know. It bothers me that people would think like that, but there are a lot of selfish people out there.
When you hear people, and I'm sure you see it on social all the time, they blame the media for this hysteria, and this is why the economy's bad, and this is just a made-up thing. We should do herd immunity. What goes through your mind when you hear that stuff? Do you just shake your head, or what do you think?
I've heard that many, many times. The question is do you hear that this is made up? It's sensationalized by the media. No, I've said many times when I used to be on the news all the time that medicine is actually sensational. That healthcare is sensational because when stuff goes on, we all kind of perk up going, oh, that could be me. So all you have to do is report on this. And I appreciate the media reporting on this. We have to get the word out that this is a bad virus. That's all you have to say. People who have actually been through it, one of my other medical directors in Seminole County, John Murray, was in San Diego and took care of people coming off a cruise ship. He called me up 2 weeks into it. He said, Todd, I didn't believe that this was a big deal. I thought the media was making it all up. This is a big deal. I've got people dying. I mean, and he went from this side to that side because he experienced it. If you experience this, I know some people that have been to New York and worked up there. This is horrible. It's horrible. So, no, it is sensational. It's going to get sensational if we don't do something. I mean, we don't have to make stuff up. It can get very, very bad. So, no, it's not a conspiracy. I mean, there's nothing made up about this.
I have a follow-up for Alan, if that's okay. Last time I spoke with you, Alan, we were talking about how Seminole County, unlike Orange County, didn't get the CARES Act money because it was just right under that 50,000 population. Governor DeSantis is expected to talk a little bit about how the state plans to distribute some of that CARES Act money to counties like Seminole County. Do you have any insight on that, and where would that money might go to?
Actually, that's probably a bit. Do you want to do
Oh,
that?
sorry.
That's
Thank
okay.
you.
Yes, please.
Thank you.
So, as we mentioned earlier in the press conferences, we're supposed to get a set of guidelines in the next couple days from the governor as to what those funds can be used for. Now, that's going to be governed by federal law under the CARES Act, as well as state provisions and guidelines. It's going to be released to us in a quarterly type fashion. 1/4 of the money will be distributed to us, then the next will be another quarter. We have to do accounting and reporting and subject to audit, and it has to be utilized for all the provisions listed in the guidelines of which we can use it for. If we don't use the funding that's given to us, or it's used for something that falls outside of those guidelines, then the county is going to owe that money back to the state. We're hoping that happens in the next couple of days. Now, to give you an example, so far, the federal government has issued almost $2.5 billion to other counties in the state. What remains at the state level is for us counties that fall below the 500,000 is only $1.2 billion. Now, if you do the math just quickly and figure out how many counties fall under that 500,000 threshold, our numbers look like if you disperse that equally between those counties that didn't get funded, it's somewhere in that $25 to $27 million range. Now, we have not been told whether it's going to be dispersed evenly or whether it's going to be based on a population or based on a need, or we don't know what the algorithm is. And that's what we're expecting to receive in the next day or so, and understanding what that is. So once we do, then we'll have a vehicle to follow and operate to get people help and also help the county. I mean, right now in Seminole County, our budget just for this year is going, or fiscal year 2021, is almost $19 million impacted. So we have to go into reserves. Fantastic. Seminole has been very conservative in keeping reserves, and the reserves are there for that. And so we're going to be able to go into reserves. But remember, in government, we tend to trail behind 18 to 24 months from the private sector. So this county and other counties and governments are going to have a huge impact in fiscal year 21-22 if the economy does not get back to where it was at.
Could you see like a rental assistance program or PPE for businesses, similar to what Orange County has done? Or
Well, I would hope. Orange County has done quite a bit with their money. I think they received $234 million, and they have a substantial population compared to ours. My goal would be to make sure we get PPE in the hands of those businesses that can't get it or aren't able to get it. I also would like to see one aspect that, if it's permissible, to help small businesses that didn't otherwise receive other federal help, rental assistance, housing, food assistance, all the things that our community needs. Fortunately in Seminole County, even though we were below that 500,000 threshold, we've been very driven by social issues in our community for decades. and we pride ourselves in taking care of our community, as well as our private partners have been very generous in helping us help the private sector or those people that need help in a community. So we're in a pretty good place, but there's still people that need help, and there's businesses that now had a certain overhead going into this before COVID was here that now are looking at 20% additional overhead because of the additional cleaning and PPE they need, but not to mention they're only open at 50%. And most business models are not built on, can I make a profit or even stay open at 50%? So we'll be looking at all those, absolutely. And on the question earlier about, you know, what could we see if the COVID spikes up? I want to assure this community, the executive group is going to do whatever is necessary to protect the public. That is our promise. Now, I agree, we don't necessarily need to shut businesses down and do those kinds of things, but we are watching this, and as you see and heard from the doctors and the medical experts today, this is concerning, and we have to continue to monitor this. If this continues to get out of hand, then we have to make and we have to take positive action to protect our community, regardless of what else is done. Our responsibility in government is to protect the public. It's public safety. So again, I can't thank the public enough. We did it before. You've heard it. I urge the young people, again, as much as you want to get out and run around and do all those things, I want you to enjoy that. I want our seniors to have a graduation, which is coming up here in the near future. We're going to be meeting about that. Our school system has done a fantastic job in working with the medical experts on how that's safely going to be done. We're about to reevaluate that and understand how that is and how that may play into some of these numbers. So this group and many others, including our great Sheriff Lima, is working continuously, monitoring this to make sure that the public stays safe. So if there's no other questions, I'm going to turn it over to Freddie for our Hispanic translation. And thank you all very much for being here.
Thank you. Thank you very much.
Buenas tardes, este va a ser el resumen en español de la conferencia de prensa el 11 de junio del 2020. Empezó el presidente de la Junta, Zembower, hablando del acto de cuidados que mencionó el gobierno de DeSantis ayer, que el plan de la Florida van a estar dando 1.2 billones de dólares para los condados que tienen una población de menos de 500,000 personas. Antes dieron un fondo de 2.4 billones para los condados que tienen más de 500,000 personas en población. Y empezando, va a ser un paso de diferentes fases para estos condados que van a recibir este dinero. Va a ser empezando un 25% de ese dinero va a ser recibido y tiene que ser aceptado de acuerdo el condado con el estado de la Florida en las reglas que necesitan hacer. Cualquier dinero que no usa el condado lo tiene que dar para atrás al estado, tiene que dar información en qué van a usar este dinero para el propósito que es, y a la misma vez tiene que dar reportaje cada tanto a cuánto es el dinero que están usando y para qué. El condado de Seminole va a aceptar este acuerdo para estar recibiendo este dinero pronto. También tenemos el fondo de emergencia para los negocios pequeños, que el máximo dinero es $5,000 y es para todo el condado de Seminole, incluyendo las ciudades de Altamonte, Castleberry, Lake Mary, Longwood, Oviedo y Winter Springs. La ciudad de Sanford tiene su programa de fondos que pueden aplicar para esos negocios pequeños que están ahí. Estos negocios incluyen restaurantes, barras, salones de bellezas y mucho más, pero no incluye los negocios que son de casa. En el fondo de negocios pequeños, la preaplicación se acabó el viernes pasado a las 12 de la tarde. Ha visto 1,200 aplicados para este programa. De los 1.200, 630 fueron aceptados por el fondo y tiene que finalizar sus últimas aplicaciones, que eso se va a hacer finalmente en el 19 de junio a las 12 de la tarde. Este fondo a los negocios que son aceptados van a ser enviado el dinero en el medio de julio. También empezó hablando de los casos del COVID-19 que han subido en las últimas semanas. Todas personas que son positivos con el COVID-19 tienen que quedarse en su casa y no pueden estar saliendo. La única manera que pueden salir es siendo a cita de doctor, y si están saliendo por otras razones que no son por esa, van a recibir una multa de $500. Ahora empezó hablando el manager de emergencias del condado de Seminole, Alan Harris, hablando de que es posible de reabrir el condado, pero a la misma vez tener precaución con el virus que está sucediendo. El equipo de protección personal están teniendo más materiales para dar. Hay ciertos materiales como desinfectante, máscaras del N95, que todavía tenemos pocos, pero los demás tipos de máscaras y paños y todo de limpieza tenemos disponible. En las últimas semanas de que tuvimos la última conferencia de prensa, ha sido 0 fallecidos en ese momento, que eso es lo positivo. Pero en lo negativo ha subido en hospitalizados y también los casos en los últimos 5 días. En los últimos 5 días ha subido los casos del COVID-19 a 94 más casos en lo que teníamos. Y en los últimos 24 horas ha tenido más casos en un día que nunca, en 30 casos. Y desde ayer noche hasta esta mañana tuvimos hasta 26 casos más adicionales a esos casos. Es importante saber que todavía tenemos teniendo citas de pruebas de manejo todas las semanas, pero tuvimos menos en las últimas semanas porque la demanda ha sido menos cada vez. Es importante darse cuenta que muchos de estos casos se están dando cuenta por ir de cita de doctores, pero no por sitios de pruebas de manejo, porque han tenido síntomas y no se han sentido bien y se dan cuenta que que no están bien, fueron en doctores, pero la mayoría de estos casos no fueron por estos sitios de pruebas de manejo. Es importante seguir las recomendaciones de tener una máscara, tener el distanciamiento social y cada rato estar lavándose las manos. Lo próximo se mencionó fue el director de médico del condado de Seminole, Todd Husty, que mencionó que esto es una situación muy importante, que no podemos ignorarlo o actuar que esto no es muy importante. Los negocios pueden abrir, pero tienen que estar muy seguros y tener precaución en todo lo que hacen. Es muy importante porque este virus se puede seguir creciendo si lo permitimos. Hay que disfrutar lo que estamos haciendo, pero a la misma vez con precaución, lavándose las manos, teniendo cubrimiento de cara y distanciamiento social. Finalmente, la directora del Departamento de Salud, Donna Walsh, mencionó que desde esta mañana, el estado de ayer por la mañana, el estado de la Florida ha tenido 67,000 casos positivos y 2,800 casos de fallecidos. En el condado de Seminole, desde ayer había 585 casos confirmados de que empezó, 12 fallecidos y 117 hospitalizados. Andábamos de casi 25,000 pruebas durante este tiempo. Vemos que en las últimas semanas ha bajado el caso hasta estas 2 semanas que empezó a subir de nuevo. Del 19 hasta 25 de abril había 44 casos. De 26 de abril al 2 de mayo había 40 casos. Del 3 de mayo hasta el 9 de mayo había 16 casos. Del 10 de mayo hasta 16 de mayo es hasta 16 casos. Del 19 de mayo al 23 de mayo, 27 casos. Del 24 de mayo al 30 de mayo, 27 casos. del 31 de mayo al 26, hasta el 6 de junio, 39 casos, y del 7 de junio hasta el 10 de junio, 82 casos. Ha habido un aumento en esta última semana o estas últimas 2 semanas y hay que tener mucha precaución. Es importante tener el distanciamiento social. Lo dimos cuenta que la mayoría de estos casos son de los jóvenes que están infectados y hay que tener precaución, no importa la edad, porque también hay que darse cuenta que estos casos pueden, los que están infectados pueden infectar a los demás que son débiles a este virus. Las pruebas van a seguir dando todas las semanas. En el Departamento de Salud en el Condado de Seminole van a tener más pruebas todos los jueves en el mes de junio, de 9 de la mañana hasta la 1 de la tarde. Pueden llamar para tener una cita al 407-665-3000 y pueden elegir la opción 1 o pueden llamar al 407-665-3700. En las próximas semanas van a seguir esas pruebas de manejo y también va a estar en el sábado, el 20 de junio de 10 de la mañana a 12 de la tarde, miércoles 24 de junio de 10 de la mañana a 12 de la tarde vamos a tener sitios de pruebas. Para tener más información y averiguar más lugares de pruebas o recibir citas, pueden llamar al número 407-665-0000, esos 407-665-0000, o también pueden visitar nuestra página que tiene toda la información en prepareseminole.org, que se escribe PREPARESEMINOLE.org. Muchísimas gracias.